Hello world, my name is Kundlas and I'm a primary care physician. Today we will be discussing about one of the very important problem which I'm encountering in my practice. These days, I'm getting a lot of patients, especially young kids who are coming with severe pain in the thumb area, sometime in the wrist and sometime in whole hand. This is happening due to repetitive movement of the thumb, and it is happening because we are using iPhones and other pro size phones for texting, gaming, more than what this thumb is intended. There are two muscles and then eventually there are ligaments which travel on the side of the thumb, and they are intended to give you this movement, but they are not intended, your hand is not intended to reach over and for the texting, gaming, and what you do whole day. But that leads to is the inflammation of these tendons, which we call tenosynovitis, and that can lead to pain, and that pain leads to muscle spasm, and the symptom continue to get worse. The only way to prevent from happening is that we need to use these hands for way they are intended to be used. This thumb and this is separated from rest of the hand. This is to provide us with a grip and use it to hold tools and not texting and repetitive movements which we are doing these days. So if we want to really prevent this thing, we need to change our habits. One of the best way to prevent this thumb pain is not to give yourself, one of the best way to prevent this thumb pain is to give yourself a break. You shouldn't be using texting and scrolling all the time your devices. Second thing you could do is do some exercises in order to prevent it. Stretch your arm like a thumbs up sign, put your hand in this thing, grasp it, and try to move your wrist towards your little finger so that you're stretching this ligament, they become loose and the muscle pain decreases. Third you could do is use ergonomic grips so that your hands, with the one hand you're holding the phone and with your other hand you're using, you're typing or texting, but texting. And then third thing you could do is you could have some anti-inflammatory medication which will help you to relieve the pain. And sometime if the symptom continue to get worse, you may need a shot in the base of the thumb to release this pain. I think the best thing is to prevent, and how you could prevent is by preventing overuse of your hand, which the way it's intended to be used. I hope this video helps, that you will change some habits and not use your thumb more than what is intended, and you will get some relief. Thank you very much.